Okay, we're all good.
All right.
All right, we're up to 52, Chad. Ready when you are.
All right, let's get rolling. Why not? So welcome everybody. Hope everyone is doing well. Pretty good week for the moment. So hopefully that continues. There's lots of cautious optimism for many circles of are things improving so dramatically just because of dumb luck? Is it because that we are finally getting closer to herd immunity? Depending on who you talk to, who you listen, at what time of the day. Last night, there was a valiant discussion about herd immunity and how we may be getting closer. And then this morning, everyone wanted to just dispel that discussion as quickly as possible. So, what it takes to get to herd immunity, I've heard everything from 30 to 40% exposed or vaccinated to 80%. We are still not really probably at 30 to 40% at this moment, but we're definitely nowhere near 80%. So nonetheless, we're seeing a fairly precipitous decline across the board, as you can kind of see here, both in our, if you look at national cases in 24 hours, we were dropping 10 or 20,000, now, 30,000 plus decrease in case rate per day. And that's been pretty true for the last couple of days that we've been kind of plummeting downwards at that rate. Locally, it's still going down. Certainly our hospitalization rate is diminishing, but our case rate has kind of returned somewhat back to earth at about 100 a day, and we seem to be kind of hovering in that range right now. But all of this has been, I just saw part of the note from Dr. Connors, has led to the question of what does this mean for those of us who have gotten the virus or those of us who have gotten vaccinated. Is now the time? Is now the time we can visit other family who have been exposed? Is now the time that we can visit mom who also got the vaccine if I've been vaccinated? And there was actually a pretty good discussion last night. I think her name's Weed. She's a physician, and I think she's an infectious disease specialist. She's on CNN not infrequently. But both Fauci and she have kind of tipped their hat that because the case rate is low, that if two parties have both been vaccinated, it may be the time where it would be safe for them to get together while their immunity is high and while the variance predisposition in the community is pretty low. The concern is it's a very small leap for people going the next step to say, okay, I've been vaccinated, I can go on vacation in Florida. And then obviously, if you're exposed to somebody on the plane that has the British or South African variant, and you go and expose someone who doesn't, you could very easily be a carrier, and you yourself will probably be fine. But you could very easily transmit that to others if you do maintain an asymptomatic infection with those variants. So, I think it's still a level of caution is probably warranted, but I think we're starting to approach that time where I think probably an epidemiologic valiant argument could be made that, if there's someone who hasn't seen their 80-year-old parents in a year and both parties have now been vaccinated, it's probably hard to argue that wouldn't be safe at this point. So I'm not necessarily advertising, suggesting that. I have no basis other than just listening to people who are much smarter than me talk about it. But I think the point that was raised by, I think her name's Wen Lee, which I think was a good one, is we haven't been focusing on all this vaccination to tell people that they ultimately can't get together once everybody's vaccinated. That's the thought of what we would get to. So if there are two parties that are now vaccinated, why shouldn't they be able to get together? That's no different than what we think we'll achieve when we get to herd immunity. So I put it out there because it's been a question that several folks have raised. Our case rate is now nearing what we were back in October or even before, when things were going well and we were saying, we just got to hold on and get through the holidays. And the vaccine, we're up to about 1.5 million doses a day. That was the push before, that Biden got a lot of pushback when he initially said that was what we were going to shoot for. Now the gauntlet has been dropped. We want to get to 3 million doses a day. 3 million doses a day would get most people access to the vaccine by end of July, roughly. Whereas 1.5 million doses a day would mean the US would be vaccinated by sometime early 2022. So we need to get to that 3 million. The limitation right now is availability of the vaccine, has been, obviously. But, as we push further, especially as we get into June, July, and the extra 200 million doses of Pfizer and Moderna come available, if we continue to maintain this current pace and we have the vaccine administration capability that we do now, we should be able to get people vaccinated in very quick order come summer. So take that for what it's worth. For anyone who's been dying to visit mom, dad, brother, whatever, and all of those parties are now vaccinated, it seems that the higher powers feel like now's the time, but just be wary of, if you're on a plane, you could theoretically carry a variant that you're largely immune to, but then spread it to people who have not been vaccinated yet. So car travel to see mom would be better than taking a plane trip with multiple layovers and exposing the family who's deciding to go to Disney World against everybody else's better judgment because they haven't been vaccinated yet. So there you go. There's my 2 cents. Otherwise, if we look at the graphics, our hospitalization rate is dropping. The only affiliate hospital that has not seen a big decrease is Noise. So Noise is still maintaining a relatively high census compared to their baseline, and more than a third of those patients are still COVID positive or kind of COVID convalescent. But all the other hospitals are definitely seeing kind of a COVID exodus at this point. You can see the ICU curve at the bottom right there is definitely plateaued and diminished. The mortality curve is starting to crest, which goes along with, as we see the crest of the hospitalization curve, the crest of the ICU curve follows. Once the crest of ICU occurs, we see the cresting of the mortality rate. The only place where we're not really seeing a decrease in mortality rate yet, as was shared by Nick Apostolaris, is Livingston and Chemung County. Pretty much all the other surrounding Finger Lakes region is seeing a decrease in the mortality rate at this point, which is good. And Monroe County is not fully seeing a decrease yet either, I should say, obviously, by what you can see on the graphic. But overall, we're in a much better place than we were. Vaccine is as quick as we can get it available at the moment, and we're seemingly heading in the right direction if only more vaccine could be made available. New diagnoses, you can see we're back down to about where we were when we came off that peak at the end of summer, but not fully back down to where we were, end of September when things were happy, kosher, very few cases, that kind of thing. So more to come on that. So that's where we stand now. Leading into the regional graphics, you can see here pretty much what we said before. Oh, sorry. Oh, thought somebody said something. So we're kind of seeing that downward trend across the map. And as I said, the mortality curve from what Nick was sharing with us also looks pretty good for most of these counties, with the exception of Monroe, Livingston, Chemung. So positive direction for all. Now into the vaccine discussion. So we are in the first week, heading into the second week of a planned 5% increase per week, on top of a 15% increase a couple weeks ago, which was on top of a roughly 16% increase. So all told, we're somewhere in the order by next week, we're going to be about 25 to 30% more vaccine than what we were dealing with, say 3-4 weeks ago or more, back in January when things started, end of December. So that's good, but still not nearly enough. And we're waiting anxiously for the Johnson & Johnson vaccine to hopefully come available. There's some thought that that'll probably happen within the next week or so. Hopefully that'll be useful. And then from there, Johnson & Johnson has a faster turnout rate planned, supposedly. But really the next big bolus of Moderna and Pfizer won't be until closer to summer, probably more realistically around June. So for the general population at large, The current discussion is that they will be offered access to vaccination appointments somewhere around June or July, and that they probably will not receive vaccine until at least 30 to 60 days after that. So, for anybody here today that's had a parent or uncle or whatever that's tried to schedule a vaccine appointment, they're largely booking out. Now, sometimes, a couple appointments open up and you can get into the Dome Arena tomorrow. But many folks are, booking into March as far as their vaccine appointment if they meet the criteria currently. So that's essentially, when Fauci had mentioned that realistically the general public wouldn't start getting vaccinated to the end of July, that's largely why. The vaccine will come available, the appointments will open, but most likely based on our current rate of vaccination, they won't be getting vaccines into arms for general public until about that end of July timeframe. Obviously, we hope that speeds up. Along with that, there is some beginnings of discussion that we may have some reports as far as efficacy in children right about that time. So right as the vaccine becomes more omnipresent in summertime, late summer, realistically, we may be able to vaccinate the entire population. And I don't know what age group of children will be included in the studies fully or what they'll be approved for. But, the anticipation is all that could follow. The president last night again reiterated after his administration had kind of balked that Jen Psaki, the press secretary, had said the goal was to have all K through 8 schools open at least, or most open at least 1 through 8. All K through 8 schools, most having at least 1 day per week by the end of the first 100 days of the Biden administration. Biden then reiterated in his town hall last night that the actual goal is that for K through 8 students, the vast majority across the country will have 5-day-a-week in-person school by the end of the first 100 days of his administration. Clearly, that's got some teachers unions ruffled and whatnot because of the concern. He's also touting that teachers and school workers be elevated in the vaccination list to try to make that possible. So we'll see where that goes. Obviously, the federal government cannot mandate that. That's a state level decision. But if those things were to happen, then realistically, it's not inconceivable that K through 8 could go back full time before the end of this school year. There's also been a little bit of discussion, although it was pretty heavily panned, about opening up summer school to play catch up for kids in K through 8 and even potentially high school who have not had full school years to date. There's a lot of logistics and obviously the rescue fund or rescue package that they're debating right now would have to be at least the size it is to give the finance for schools to be able to run over the summers. And obviously there's concerns about what that means for parents and kids being home, blah, blah, blah. So we'll see where all that goes.
I don't know. Where do I sign that petition?
I'd say I'll put my kids in year-round school right now. That sounds great. Not have to pay $4,000 a day for camp or whatever crap that they charge us for. So yeah, I'm all for that. I'll elect Biden to 64 terms if he'll promise me that alone. So, so we'll see where all that goes in the coming weeks. I'm sure a lot of discussion is hinging on this rescue bill that's going through. So it sounds like they probably, Joe Manchin was probably on the fence. It sounds like he's probably on board to vote with the Democrats. So they probably have the 51 votes necessary to move it through the Senate for the $1.9 trillion package. They are hopeful that with the goodwill tour that the president's kind of putting on with the town hall, and then he's supposed to be in Michigan today, that they'll be able to pull over some of the moderate Republicans to make it a bipartisan arrangement. But the thought now is that may pass as early as March, which will accelerate funding, obviously, for states, school systems, and the like. So we'll see where that goes. There's still a lot in between here and there, but that's where we stand. As far as the vaccination effort, and again, I have no real inside knowledge of exactly how things play out, and with the disclaimer that I will change my tune tomorrow. The hospitals really are getting almost no vaccine at all at this point. So they are getting, so for instance, I think Strong got something on the order of 200 doses with very explicit instructions that it was for 1A providers only. Beyond that, they could do, grander 1A providers across the region. And then if they had excess after that, they could vaccinate patient population that currently meets criteria. So the reality of, all of us kind of waiting for our patients to get randomized and called by the U of R or even Rochester Regional to get invited for a vaccine, that is very small amounts of vaccine that's getting administered at this point. The Finger Lakes Task Force is redistributing some. So the thought this week is there may be another 100 to 200 doses that may be available so that the hospital can vaccinate patients. But largely the vaccine is being distributed to the state pod, the Department of Health, and to pharmacies. So much so that I think the likelihood that the hospital is going to do any significant volume of vaccination of patients is almost nil at this point. Likewise, I am having less and less confidence that there's going to be any vaccine that's going to be distributed to practices anytime soon. The importance of this is twofold. One, I don't think it's time to gear up a big vaccination plan for the practices. But two, I think it is important that we communicate to our patients that the way they're going to get vaccinated for the foreseeable future is they are going to have to get online and schedule their appointment either at the state pod or through one of the pharmacies. Now, as vaccine comes more available, it may be easier to get it through a pharmacy and they may not have to sit online and schedule it. And I realize that there are significant concerns with, elderly having access, people with chronic disease having access, being able to do those scheduling requirements. And I've heard from a multitude of people of, many of you who are trying to schedule family members who have chronic disease or parents that have sat online for 2 hours, got kicked out of the Dome system only to sit online 4 hours to be able to schedule a parent at the fairgrounds in Syracuse. So it's a pain in the butt. And it really does require just sitting there and waiting in queue to schedule those appointments. The people who are persistent are getting appointments. I've been impressed that people are scheduling extended family members, and it takes some time, but they're doing it. But it takes the dedication to kind of work the system a little bit, which is a pain in the butt. I wish I had control over that. I don't. But for right now, I would say for your patients, we're hearing a lot who patients who either do get calls from the U of R who get the report back of, no, I'm going to wait till my primary care physician has it and I'll get it then. Or people who say, look, when my primary care doc calls me, I'll probably get the vaccine then, but I'm not going to go through the hassle of sitting online with Wegmans or with the State Dome or whatever. I don't think those people are going to get vaccinated anytime soon if that's the tack that they take. So I realize that's not a great story. I wish I could say that I had some control over making it better, but I think that's the reality of where we sit at the moment. Obviously, Johnson & Johnson, if there's 100 million more doses that hit the market and they send it to practices, it'll be a different story. But I'm not hearing any inkling of that at the moment. So just want to put that out there so that folks can start advising patients, at least for what I would foresee is at least the next 2 to 3 weeks, that's probably the way of the world of how to get a vaccine at the moment. I did see some mention in there, how does a 16-year-old with chronic disease get the vaccine? So this is a good time to point out, how do they obtain the Pfizer vaccine? Damn near impossible at this moment, I would say, to be able to pick and choose what vaccine you get. Truthfully, Tim, I don't even know that I can give you an answer that that's a possibility. I would say that would be very unlikely at the moment. They may be able to get a vaccine by calling and scheduling someplace, but I don't think they'll be able to guarantee that they would get Pfizer at this moment. The Dome, everybody says once you actually get the appointment, that the facility is actually doing very well, that the throughput, the kindness and professionalism of the staff is great. So I've heard that multiple times, that the fairgrounds and the dome are really excellent once you get there. You can select to get a call back. Yeah, that's true. So the phone line, although I heard several people say they never got that call back. So take that for what it's worth. I'm sure that's just as inundated. So, that's that. Moderna's okay, 16. You're right. Sorry. So a 16-year-old that wants Pfizer, I would say you put it into the appointment queue, and they will. So like if you go to the State Dome Arena, they do have Pfizer. If they schedule you an appointment, they'll make sure that you get what's appropriate for, what's approved for you. So I would say right now that the 16-year-old, I don't know that pharmacies are getting Pfizer. I think they would have to go through the fairgrounds or the Dome Arena right now to get it. So yes, sorry, I should have been clearer about that. They can't get Moderna. You're right. There was something else I was going to say about vaccine. It'll probably come to me in a moment. We've had a lot of conversations at the task force level about patients needing some type of attestation from a physician saying that they do have a chronic disease so that they can get the vaccine. There have been widespread reports, although many of them not correct, it seems, that patients have been turned away because they did not have their letter from their physician saying that they met chronic disease criteria. So two things. With the exception of Steuben County, if they are in the 9-county Finger Lakes region, there is not a requirement at the moment to have a letter from the physician. All of the Finger Lakes region is accepting personal attestation from the patient that they meet the chronic disease criteria. Immediately, that raises 2 points. What the hell is going on in Steuben County? Why are they being difficult? I'll come back to that one. Number two, how do we know patients are being honest about that? That's a really good question. And I don't think I can tell you that they're being completely honest. I'd be lying to you. My understanding is to date, no one has been turned away at the Dome or the fairgrounds. That, if they had tested, they got it. They did not get turned away because they didn't have a letter. I do think there was some very early on through the Department of Health that may have gotten turned away because they had no proof of chronic disease, but that has now been rectified with this task force discussion. Steuben County, there is a lot of ongoing negotiation. My understanding is it only affects the county vaccination clinics through Steuben County. Any state-run pod or any pharmacy is vaccinating with just patient attestation, but that Steuben County has still been adhering to, they need a letter from the physician or some type of attestation from the patient's medical record saying that they have that chronic disease. There is ongoing discussion with the Steuben County leadership literally as we speak. So I suspect that will change. It is true. So for folks who are going to out of county, so they're going to Kenny Drugs in wherever, or they're going to Erie County to get vaccinated, those areas are outside of the Finger Lakes task force domain. And so they are being asked to bring an attestation. We're trying to work through that right now, both to say, can we just make this patient level attestation a statewide acceptability? So that conversation is being had with the governor's office, or can we output some type of report that says that the patient does meet chronic disease criteria? There's a lot of concern that sharing patient health information with people at these vaccination sites is unnecessary and perhaps improper. So what the current conversation is if we need a letter, can we just have a generic phrase that is, this patient meets chronic disease criteria as set forth by New York State for COVID vaccination? It doesn't say what their criteria is. It's just that letter. It can be dot phrase so that it can be output and sent to patients. And potentially we could do that from Epic or potentially even Arcadia if we really had to. We're trying to get around doing that at all. And we're definitely trying to get around putting that burden on the provider offices because that will obviously grind business to a halt. So we've made some headway locally. Steuben County, I think, will come under the tent very shortly. But we know, patients are scheduling appointments all over the place as they can find access across really Western and Central New York. So because of that, they may need that note if they go outside of the 9-county Finger Lakes Task Force domain. And so that's why we're trying these other avenues. So more to come on that. I suspect we'll get resolution of that hopefully this week. There's been a lot of discussion for the last several days. We're already in a better spot than we were, but hopefully we'll get this resolved completely. So that's where we stand on that attestation. Hopefully that will decrease the phone calls that you guys are getting, but I realize that doesn't make it any better today and tomorrow. Next piece, which is about pre-visit or pre-procedure testing. This probably doesn't apply as I look through the group to most of the folks on this call. We still have some of our subspecialty offices that are not sending patients with order forms to the U of R pre-procedure testing site. It's causing patients to get held up there while they're trying to reach out. If it's a really busy time, they don't have time to reach out to the subspecialty offices to get that order sent over. So those patients are going to get turned away. They're going to be angry. And unfortunately, there's nothing we can really do about it because it in some cases, I know some of the offices are closed for a couple hours at lunch. It seems like every patient every day is showing up at lunchtime to get their pre-procedure testing. And so when they reach back out to the office, they can't get the order because the office is closed for 2 hours. And so the patients either have to sit there the whole time or they get turned away and they're mad. So I realize I'm kind of preaching to the group that has very little role in this, but if for any reason you're sending patients, please, please, please make sure that they go with that order in hand. Renee, I know you said you didn't have anything else. I don't know if there's anything I said that you want to correct.
Did you mention visitation?
Oh, I did not.
The hospitals?
I did not mention that. So there you go. So all of the hospitals are now opening back up to patient visit or to have patients be able to have visitors and or significant others accompany them in the hospital because the case rate is going down so much. I don't think there's any hospital that either hasn't opened it up or will not be very shortly, at least within our system. I think that's a community-wide effort now. So that should, if it hasn't changed yet, by the end of the week, all hospitals, I think, in the area will be back to allowing visitors, is my understanding. I think Noise had already allowed folks. I think FF Thompson had gone live first. I think Strong and Highland are live now. Noise or Jones and St. James, I think we're going live at about the same time as Strong and Highland. So that should, obviously, from a patient satisfaction, comfort, actually even ability to discuss discharge planning, hopefully that makes things a little bit easier with that back on board now. I think that's all I've got.
Chad, just want to mention the PPE survey went out this morning. Get your orders in, as you can expect a larger load of allocation. And I'm not sure if you have anything to add about the PPE supply that's left over.
No, so I'm working right now. This sounds kind of ridiculous. So we've gotten promise of a space on the first floor here in the building that we can store the big surplus of goods. Yes, it's a good day. But unfortunately, you have to have a swipe card to get into that room. And so we're trying to figure out how I get the magical swipe card access to do that. So I have to get the magical swipe card access so that I can schedule the guys from the loading dock so we can get it delivered here. So if all that happens before next Tuesday, Wednesday, you will get a large surplus of goodies. If not, it will be a paltry sum of goodies. So hopefully we'll get that resolved in the next couple of days. But that is.
So which class at medical school prepared you for this aspect of your job?
This is under the clause of other duties as necessary, I think, that exploded during COVID, to say the least. But I am now mastering the art of swipe card access. So it's great. All right. Anything else that people have? I think we've run through the chat room. Yes, okay, very good. Any other questions that folks have? Or any disagreements with anything I lied about? All right, hearing none, you'll get 14 minutes of your life back. We will see you all next week for PPE distribution on Wednesday. We'll try to get out the measure. If we really have problems about getting the stuff over here, we'll let you know. But I don't anticipate that'll be a problem. And then we'll see you back here next Wednesday at 12:15. Have a good one, everybody.